All right. Well, we are seeing some really disturbing and saddening consequences from COVID-19 beyond just the pandemic itself among our military community. And joining me now is Jeremy Stalnecker, the executive director and co-founder of the Mighty Oaks Foundation. And Jeremy, thanks for joining us here to talk about this. But it's a disturbing topic here. We hate to see this, but COVID-19 is having a negative impact on our military.
Yeah, absolutely. These the policies that we're seeing, particularly related to isolation and separation, are having an incredible impact. This is something that those of us who work in this space have talked about for a long time. I wrote a blog on my personal blog about this back in April in response to an ABC article that said calls to the mental health line for the United States have gone up like almost 400% year over year. And that's not just military, that's everyone. But anecdotally, we look at those in our space, veterans and service members who are struggling. And one of the worst things you can do when you're struggling with mental health and with these issues related to combat trauma, trauma related to service, is to separate, to isolate, to stay away from people that can help you, to limit services through the VA. And yet those are all the things that have happened. And this week, we finally have some data to really illustrate, I guess, what most of us have believed. And it's a very, very difficult time for those who have served and are serving.
Yeah, and we're seeing this spike as well in the people who are currently serving, right? It's not just former
Right.
military who are now just sort of at home. So explain, why that might be the case for, I mean, are we seeing these restrictions in military units as well?
Yeah, what's interesting is in 2016, when we first really started as a nation looking at suicide rates as they apply to the veterans and active duty service members, we said that veterans were committing suicide, were taking their lives at a rate of nearly 22 a day, and that's where many of the organizations and the push-up stuff to bring awareness to this, all that was based on the 22. And at the time, we said 1.5 active duty service members a day was also taking their life. A new study was done a few years later, and now we're saying that the rates have been closer to 20 a day on the veteran side, but almost 4 a day on the active duty side. So this is pre-COVID. This is just what the statistics and what the rates are right now. But this week, an article came out. Fox put out an article, and some other news organizations reported on the findings presented to the Department of Defense from the heads of our military branches. And again, this is what we've been talking about, but we're seeing it happen. In the military across the board, we're seeing a 20% increase in active duty suicides and violent crimes, 20% throughout the period of COVID. The Army is saying it's as high as 30%. And yet in all of those, so 20% higher military-wide, 30% in the Army alone, the first 3 months of this year, we saw those rates going down from 2019. So we're on the right trajectory. Things are happening. The VA is starting to get a handle on some of this. COVID hit, the isolation measures, the quarantine measures, all those things were put in place. And now, year over year, we're seeing 20 and 30%. The Air Force, interestingly, is sitting exactly where they were last year, which sounds great. But last year, 2019, was the worst year in 30 years for suicides amongst active duty folks serving in the Air Force. So, with the downturn early in the year, we had hoped that those rates would go down, and yet they're right back where they were last year. So the data is terrible. And the question is why? And a lot of it is simple isolation. We have a friend whose son just went to MCRD boot camp, just started this week. But prior to actually checking into MCRD, he has to spend 2 weeks quarantined, so 2 weeks isolated. Then he'll go to boot camp and then spend 2 weeks isolated on the other side of that. Now, he's a new recruit coming into the Marine Corps. We could expect something like that. Those who are serving there at MCRD, the drill instructors, have got to quarantine themselves essentially for the entire 3-month period of boot camp. So they're not going home. They're not spending time with their families. They're not interacting with their children or the people that they care about. They're not going to church. They're staying 3 months at a time on this cycle. Now, these are active duty Marines. And we see this throughout the military on deployments. So there is a quarantine time on either side of a deployment. A 7-month deployment is now an 8-month deployment. The isolation from family if something happens. If someone gets hurt and goes into the hospital, family members cannot come and see them because of the restrictions. And so the hopelessness that already exists because of combat trauma and the issues often associated with serving in the military now are compounded because these folks who are struggling are isolated from the people that care about them the most.
Yeah, that's what I was going to ask you about that. You at Mighty Oaks, obviously, you guys are working with veterans and trying to help them with all
Yeah.
kinds of different issues, especially mental health issues, and
Right.
combating this and trying to get this number down. What are the typical things that you guys find yourselves dealing with? Because a lot of people on the outside will just see like, oh, these numbers are up, like you said, isolation
Right.
and things. But what is being exacerbated when something like a pandemic comes along where we're
Sure.
being forced to be quarantined?
Well, one of the things that happens for anyone dealing with mental health issues, and this could be clinical depression, or we're just feeling bad, we're going through a difficult period like everyone in the United States is right now. You start to have thoughts in your head, and those are often unhealthy. But generally speaking, in a healthy, when someone is healthy in their relationships and they have opportunities to connect with other people, they're able to process those thoughts, process those feelings, normalize those, and whether it's dismiss them and move on with their lives because they've been able to normalize that and work with other folks, or get the help they need because someone in their life can say, look, you need a different level of help, and we're going to get you to that help. When you isolate yourself from the people that care about you, the people that are asking the hard questions, the people that know how you typically behave, the warning signs are not available. People are not catching these symptoms and these situations early. And the person who's suffering or struggling does not have the ability to offload what they're dealing with. In our program, we deal with combat-related trauma, as well as just trauma related to military service for veterans and active duty service members and their spouses and their families. And we go through a process that really helps them align their lives to the life they were created to live by God. But a big part of this process for us is having a staff working with students, the staff coming from a military background, having struggled themselves, come through our program, found hope, healing, and direction, and now they're helping others. So we find people who are struggling in an environment with other people who have also struggled, but they have the opportunity to process through that, to tell their story, to understand what they should be concerned about and what they shouldn't. There's a point in every one of our sessions. It takes a week. We bring folks to one of our facilities. Late in the week, we have a time where everyone has the opportunity, every student has the opportunity to tell their story. And it is an amazing thing to watch someone who's carrying a burden, who's carrying things they've never shared with anyone, now sharing it in a room of folks who understand, who get it, who know where they're coming from, and offloading that burden. It clears the mind, it clears the vision, it allows for the steps to be taken to move forward. When we isolate, we don't have the ability to do that. And there's so much more that goes into that. One of the phrases we use in our organization is never fight alone. It's isolation that will absolutely kill, and it does. When we see folks who are isolating, whether it's, we catch the signs on social media or they won't answer their phone anymore, return an email, we lean into that because it's very, very dangerous. And now, in a lot of cases, we have government mandated isolation, and it's very, very dangerous.
Yeah, and I even think of just the long-term effects it's going to have on on just everyone, because we're
Yeah.
kind of being trained almost to isolate, which is kind
Yeah.
of sad. Like, don't go near these people, don't talk to these people. Just anecdotally, I was watching a sports clip the other day, and the crowd was celebrating, and they were
Right.
the players were like hugging each other, and and it was amazing though how much I realized I missed that
Right.
even
Right.
just watching it on TV. Like, there's
Absolutely.
something inside us that God's created within us that we were meant to do life
Yeah.
together, not isolated and not alone. So obviously, Jeremy, Christians want to be praying for our troops. We should. I mean, I think we all do, but we should hold those who serve in high regard and have them in our prayers often. But what can people do? The average Christian watching this, and they're their hearts are breaking for people that are struggling, in our military with thoughts of self-harm. What can we be doing as Christians?
Yeah, I think there are a lot of things. I do work for an organization that approaches this from a faith-based position. So one thing I would say is point those who are struggling to resources like those found at the Mighty Oaks Foundation, mightyoaksprograms.org. That's our website. Our program doesn't cost anything to the student, and we'll cover travel to get them there. So we are one of several organizations that do things like that. Point folks to a place where there is hope, where there is the offer of help. We've tried to remove every obstacle to those who need help to getting it. And so that's one thing that certainly can be done. Pushing back against some of these restrictions, as simple as it sounds, is very, very important. In March, in the middle of March, we were running a full slate of programs. 30 weeks a year we have programs. We have about 1,000 students come through those programs. Again, we're representative of others who are doing the same. And we do approach all of this from a faith position. We talk about trauma, we talk about combat, we talk about military service, and we talk about our identity being found in Christ and moving toward what God created us to live. In mid-March, many of these restrictions came into place. The 4 facilities across the country that we use shut down, and we weren't able to have those programs anymore. We scrambled, we tried to figure some things out. We did an online program, which is not ideal because, again, as you mentioned, we should really be in contact and in fellowship. But we did it. The very first time we did it, one of the guys at the end of the week said, "I would have killed myself had you not done this." He then, a couple of months later, came to an in-person program, and we were able to help him out. But that's the story of many folks who are out there. Their lifeline is to an organization or to an institution. Maybe it's to a church. Again, fellowshipping in church is so important.
Yeah.
Their lifeline is to these places where they can get help. And when that lifeline is taken away, really they look around and just come to the conclusion that it is helpless. So moving forward in our communities and opening up in these places where help can be found, and then pointing the folks that we care about to faith-based organizations who are pointing to Christ as the solution.
All right, Jeremy Stalnecker, thank you so much. Mighty Oaks Foundation, thanks for addressing this issue. Thanks for the work that you're doing to help our veterans, and it's very much appreciated, and I appreciate your time today, sir.
Thanks, Dan. Appreciate it.